Hello, I am Dr. Lorance Peter, Consultant and Chief of Gastroenterology and Director of Medical Gastroenterology at Sakra World Hospital. But what are the common causes for bleeding? One is we can classify this into upper intestinal bleeding and lower intestinal bleeding. Let us talk about the upper intestinal bleeding. Upper intestinal bleeding is usually presenting as either blood vomiting or hematemesis or passage of black stools. And what are the common causes are, one is ulcer related bleeding. Ulcers are very common because patients are now given a lot of blood thinners like aspirin and clopidogrel and other blood thinners because our life expectancy has gone up. Many of these patients are on blood thinners for cardiac or neurological causes, and then they develop small ulcers and they start bleeding. The other causes are, you can have variceal bleeding because of liver cirrhosis and portal hypertension, which are very massive bleeding. In portal hypertension, you can have bleeding from esophageal varices, gastric or stomach varices, ectopic varices, gastric antral vascular ectasias, and even portal hypertensive gastropathy. All of them can have cause bleeding. Then other uncommon causes of upper GI bleed include Mallory-Weiss tear. Patients retch, vomit, and then starts bleeding because there is a tear in the food pipe. Or then there are rare causes like polyps, malignancies, and dulophoid lesions. They all can bleed. So whenever there is bleeding, you should immediately bring to the patient to the hospital. The causes of lower GI bleeds are varying from age. Younger patients have fissure and polyps as a common cause for bleeding, but in older people it can be hemorrhoids or piles, and then polyps and malignancies and diverticular disease, angiomalformations. These are the causes for bleeding, and they present with fresh blood in the stool. And this nowadays we are seeing a lot of patients of bleeding because of increased use of aspirin in cardiology and neurology for prevention of stroke and heart attack. And early hospitalization and identification and resuscitation of these patients are important to prevent further bleed. And we might do some blood tests and sometimes X-rays and ultrasounds rule out other causes of bleeding and we to arrive at the cause.